Hey everyone, it's Carly Burridge. I'm back after a brief hiatus. We're back for another episode of What's Up Wednesday. So every Wednesday I either review a recent journal article or a book or something else related to obesity management, and we tie it back to how you can incorporate this in your clinical practice. So the study that we're going to talk about today was from the latest edition, the August edition of the Obesity Journal, and the author is Wing et al. And the Look AHEAD research group. And the title of this is, Does Lifestyle Intervention Improve Health of Adults with Overweight and Obesity and Type 2 Diabetes? Findings from the Look AHEAD Randomized Trial. So most of you are probably familiar with the Look AHEAD trial. In case you're not, this was a very large randomized trial testing the long-term health effects of intensive lifestyle interventions in over 5,000 subjects with overweight or obesity and type 2 diabetes. So you might be familiar with this, but the Look AHEAD trial was stopped after 10 years in 2012 because they did not see any significant effects in the reductions of cardiovascular disease, morbidity, and mortality, which was the study's primary endpoint. And so they compared the intensive lifestyle intervention group with the typical diabetes support and education. That was kind of the control group. And they did not see any differences, and therefore they discontinued the trial. However, a lot of the secondary outcomes that they were looking at include a whole broad range of health parameters, which we'll talk about today, related to diabetes and obesity. And those actually continue to be studied by numerous groups using the post-interventional observational phase and looking at a lot of those things. So what they found was that the intensive lifestyle group actually had benefits in a lot of these secondary outcomes compared to the typical diabetes support and education. So what they saw, some of the positive effects were differences in body weight, improvements in body weight, hemoglobin A1C, remission of type 2 diabetes, reduced nephropathy and neuropathy, reduced depression incidence and symptoms, improved physical health and quality of life, reduced sleep apnea, reduced healthcare use and costs, reduced geriatric syndrome as some of these subjects were aging, reduced urinary stress incontinence in both men and women, reductions in non-alcoholic fatty liver disease and hepatic steatosis, reductions in multimorbidity, so multiple complications of obesity, reduced disability and increase in disability-free years, and differences in brain structure as looked at by MRI. So as you can see here, there were a lot of health benefits and a lot of benefits to the intervention, to the intensive lifestyle group, which also did have more significant weight loss and were more active and had a lot of these lifestyle factors that they were incorporating. Some of the non-significant differences, so here they did not see a significant difference between the two groups, and that is, of course, in the cardiovascular outcomes, which was their primary endpoint. But there was also no significant differences in cancer or cognitive function or impairment. So even though they saw differences in the brain structure, that did not appear to translate in the cognitive function. And also, they did not see a significant difference in total knee replacements. Although there were differences, those who did not already have knee complaints in the intensive lifestyle intervention when they started the trial actually did have a reduction of total knee replacement. It just, those people that already had knee complaints when they started the trial, there was no difference there in total knee replacement. So once the damage is done, the damage is kind of done. Some negative effects that they saw of the intensive lifestyle intervention were that there was more muscle mass loss during the weight loss phase, especially that first year when the average weight loss was about 8.5% total body weight. So they saw more muscle mass loss in this group, which is to be expected. When people lose weight, they don't just lose fat mass, they also lose some muscle mass. So it's just really important, again, maybe to adjust the treatment plan so that we can eliminate this as much as possible, reduce it as much as possible by making sure they're eating sufficient protein and doing sufficient resistance training. And they also saw that there was less or a decrease in bone density in the intensive lifestyle intervention group and an increase in frailty fractures. So again, of course, it's important that we individualize treatment, and we would do that with our patients, but in a study like this, you can't necessarily do that. I also thought that a really important finding was that the age and the baseline health of the subjects really affected the benefits that they received from the intensive lifestyle intervention. And the younger and healthier subjects seemed to have greater health benefits long-term than those already had higher BMIs and who are already sicker at the onset, who had had type 2 diabetes for longer at the onset. So, I mean, this makes a lot of sense because obesity and many of the related medical complications and conditions are progressive, and it's a lot harder to reverse the damage once the damage has already been done. So I think a really big takeaway from this is to treat early rather than to wait until the obesity becomes severe or until somebody develops complications of obesity, right? So sometimes for us as providers, it might feel more gratifying to us when we can take a patient who's really sick, when we see an A1C of 9, 10, 12, and we see that A1C plummeting, or we see their triglycerides slashed in half, that can feel really rewarding for us. But I think it's important to remember that this study reminds us that where we can really make an impact is if we treat patients and help patients before they develop a lot of these complications. That's where we can really have the biggest impact long term. And I think the study also highlights once again how difficult it is to lose weight and keep it off with lifestyle changes alone, because we see that a lot of these people in the intensive lifestyle intervention group did regain about 50% of their weight by year 8. And so it's just difficult with the biologic and the metabolic adaptations that occur with weight loss. It's difficult to keep that weight off long-term with lifestyle changes alone. But the good news is that, we now have more and more studies coming out. We now know more about ways to help overcome this metabolic and biologic adaptations with things like, whether it's dietary, like therapeutic carbohydrate restriction, like is being studied by Virta Health, or whether it's with anti-obesity medications or surgery. So we now have more tools available to us that can help us overcome some of these biologic adaptations that occur in the weight reduced state. So if you're a provider or an organization who wants to incorporate obesity medicine, but you're not sure where to start, or you're looking for some guidance to help you put together a comprehensive program, please check out our resources and our support at gaininghealth.com. That's all we do. That's what we're here for. So thank you so much for your time, for checking in, and I look forward to seeing you all back next week for another episode of What's Up Wednesday. Take care.